Sinusitis. Before we can answer that question, we should talk a little bit about anatomy. Sinuses are hollow spaces in the bones around the nose that connect to the nose through small, narrow channels. Humans possess 4 paired paranasal sinuses. Your cheekbones hold your maxillary sinuses, the largest. The low center of your forehead is where your frontal sinuses are located. Between your eyes are your ethmoid sinuses. In bones behind your nose are your sphenoid sinuses. They're lined with soft pink tissue called mucosa. Sinusitis means your sinuses are inflamed. What causes sinusitis? 98% of sinusitis occur due to viral infection. It can also be caused by bacterial infection, while a small population can have it due to fungal disease. There are some predisposing factors that make it more likely that you get sinusitis, including allergic rhinitis, which makes it easier for infection to occur, exposure to smoke or cigarette smoking, anatomical abnormalities which make it difficult for sinuses to drain. The central event in sinusitis is blockage of the sinus openings, or ossia, as a result of inflammation. Unable to circulate air and eliminate the secretions that are produced, obstructed sinuses become an ideal environment for bacterial infection. Types of sinusitis. Types of sinusitis include acute sinusitis, which lasts up to 4 weeks, subacute sinusitis, which lasts 4 to 12 weeks, chronic sinusitis, which lasts more than 12 weeks and can continue for months or even years, recurrent sinusitis with several attacks within a year. What are the signs and symptoms of sinusitis? First thing that most people notice is going to be pain. The pain may be localized to the sinus involved, or it can also cause generalized pain which may present as headache. If you tap on the sinus involved with finger, it can produce tenderness. Also, since the mucosa is inflamed, it will produce lots of mucus, which is going to drain into the nasal cavity through sinus openings or ossia. Once in the nasal cavity, there's only 2 things it can do. First thing is to come out of your nose so people will notice nasal discharge. The second thing it can do is go to the back of your throat, as the back of your nose is related to back of your throat, and there it causes irritation and cause you to cough. Inflammation of mucosa can also alter the smell and taste of things. Patients can also have fever because of the infection and inflammation. How can we diagnose sinusitis? By and large, the diagnosis of sinusitis is made by symptoms alone. Common symptoms include nasal or postnasal drip, sinus pain or pressure, nasal congestion, decreased ability to smell, cough, headache, and fever. But sometimes the symptoms aren't clear-cut. In that case, there are some other tests that can be done to diagnose. Sometimes a medical practitioner will take a look inside your nose to get a better look at nasal or postnasal drip. This is called rhinoscopy. X-rays can be done to visualize sinuses. The gold standard to diagnose is CT scan. Other tests are only done if needed in special circumstances. How can we treat sinusitis? For acute viral sinusitis, the most common type of sinusitis, there is not a lot we can do to actually treat the disease itself, but we can treat symptoms. One of the first drugs to treat symptoms is going to be nasal decongestants. These medications shrink swollen nasal passages, facilitating the flow of drainage from the sinuses. We also give mucolytics medications, which help clear mucus. We also ask the patient to remain well hydrated, as being well hydrated helps in drainage of mucus, as mucus formed is not so sticky that it gets stuck in if your body is well hydrated. Finally, we also give painkillers to help relieve the pain. For acute bacterial sinusitis, we give all of the above plus antibiotics for 10 to 14 days. For chronic sinusitis, again, all of the above, but the antibiotics have to be given for a lot longer period. Most people recommend 4 to 6 weeks of antibiotics. If the sinusitis is too severe and the person is at risk of complications, we go for surgery. Surgery may be done to remove small amounts of bone or other material blocking the sinus openings, or to remove growths blocking sinuses, also called as polyps. Normally, a thin lighted tool called an endoscope is inserted through the nose so the doctor can see and remove whatever is blocking the sinuses. Tonsillitis and tonsillectomy. When a person opens his mouth, there are a lot of things you can see. One of the most important organs that help fight off infection are among them, also known as tonsils. Tonsils are often overlooked when you open your mouth. This is because they are often small and hidden between the 2 arches. These tonsils are known as palatine tonsils due to their location near the palate or the roof of the mouth. How tonsils fight off infection? The tonsils act like a sentry point for the throat, picking up virus and bacterial particles which are breathed in or swallowed, and relaying these to the immune system. To help with this role, the surfaces of the tonsils are pitted with a number of little recesses, also called tonsil crypts. These increase the surface area of the tonsils, relaying more viruses and bacteria to the immune system. How tonsils get infected? Tonsils can also become clogged with bacteria and food particles, which can lead to problems. When this happens, the tonsil itself becomes infected and starts to get swollen due to inflammation because of infection, leading to a condition known as tonsillitis or inflammation of the tonsils. Because the tonsils are always trapping bacteria, they can become infected quite commonly, especially in children, leading to a condition known as recurrent acute tonsillitis. Signs and symptoms of tonsillitis. The main symptom of tonsillitis is sore throat, but since the throat and ears share the same nerves, the pain is often felt in the ears too. This process is known as referred pain. The pain is usually worse when swallowing, also known as odynophagia. Very young children may not complain of a sore throat, but may simply refuse to eat. In addition, you may also have a cough, fever due to infection, headache, feel sick, feel tired, and swollen and tender glands, lymph nodes on the sides of the neck, as well as bad breath. How tonsillitis is diagnosed? Diagnosis is based on a physical examination of your throat. Your doctor may also take a throat culture by gently swabbing the back of your throat. The culture will be sent to a laboratory to identify the bacteria causing the throat infection. Treatment for tonsillitis. A mild case of tonsillitis does not necessarily require treatment, especially if a virus, such as a cold, causes it. Good rest and remaining well hydrated are treatment of choice in such cases. Painkiller medicines can be added to relieve the throat pain. Treatments for more severe cases of tonsillitis may include antibiotics or a tonsillectomy. Antibiotics will be prescribed to fight a bacterial infection. It's important you complete the full course of antibiotics. Tonsillectomy is the surgical removal of tonsils to permanently end the problem of tonsillitis. Criteria for tonsillectomy. At least 7 episodes in the previous year, at least 5 episodes in each of the previous 2 years, or at least 3 episodes in each of the previous 3 years. How tonsillectomy is done. Dissection and snare method. There are multiple methods to do tonsillectomy. One of the most commonly used is dissection and snare method. Steps of dissection and snare method. 1. Patient is placed in rose position. 2. Boyle-Davis mouth gag is introduced and opened. It is held in place by draphins, bipods, or a string over a pulley. 3. Tonsil is grasped with forceps and pulled medially. Incision made in the mucous membrane. 4. A blunt curved scissors may be used to dissect the tonsil from the peritonsillar tissue and separate its upper pole. 5. Tonsil is held at its upper pole and traction applied downwards and medially or scissors until lower pole is reached. 6. Wire loop of tonsillar snare is threaded over the tonsil onto its pedicle, tightened. 7. Pedicle is cut and the tonsil removed. 8. A gauze sponge is placed in the fossa and pressure applied for a few minutes. 9. Bleeding points are tied with silk. Procedure is repeated on the other side.